So students, the first thing I wanna talk to you about is the mitered corner. The mitered corner is what we refer to as like the military corner. Okay, so I'm gonna show you on this bed over here first, and then I'll let you practice on whatever end of the bed that you prefer. So once you put on your new top sheet, which we've not done yet, we always wanna tuck the top sheet at the bottom. If you tuck the top sheet along the sides, what do you form? The patient can't remove freely. What is that called?
Like a trap vision
So a restraint.
restraint.
So during the test, there's only 3 items that you have to put on the bed. What are those 3 items?
It's sheet, top sheet, and pillowcase.
Yes. In the real world, how will you know what to put on the bed?
Whatever the facility.
Exactly, whatever the facility standard is, and usually the housekeepers, they follow the facility standard. So usually have a pad, a blanket, etc. That is not the standard for the test site. So the mitered corner, of course, I'm teaching you in silos again, but once we have the bottom sheet, the top sheet tucked at the bottom, you would lift the side nearest you. And it works better for me if my bottom is toward the footrest. I'm gonna lift up one layer of the material, bring it up at an angle. It makes like a V. What do I do with the rest of the material? Tuck it under, and when I bring it back down, I have a V. That is not a requirement for your test, but it does make your bed look neater. So everybody, I'm gonna untuck these sides. We have 4 students, so we have 4 corners on the beds. I want you, each of you to go to a corner of the bed and make a mitered corner. So one layer of the material goes up, one layer up at an angle, tuck the remainder. Good job, up, tuck the remainder, and down. Oh, you're military, you got this, this is so easy for you.
It's a small V.
I know, it's a small V, but it's a V. You know, you didn't buy the linens, that whole
Oh,
that Ulysses nursing home. All right, very good. That is beautiful, great job, everybody. Let's talk about these pillowcases. So at the end, one of the last things that I change, unless the pillowcase is obviously contaminated, the last thing I'm gonna change is gonna be the pillowcase, because of comfort. Older patients do not like laying flat. Sometimes they have respiratory issues, etc. So if the pillow is not obviously contaminated, I will leave it on. Someone's like, well, you're contaminating the bed. Contaminating the bed with their own germs. Because in the real world, this would have happened after you gave the person a bath. It wouldn't just be in a silo like it is for the test, where the only thing you're doing is changing linens. All you're gonna do is pull the case off of the pillow. You can put the pillow on the table. Get you a new case. Don't let anything touch you. I know who's gonna have the hardest time with this. Marlene. And then you can either roll or scrunch. But what you can't do is shake the pillow and the pillowcase, and you can't put your arm in the pillow. Once, I like to go all the way down until I see the seam. So it doesn't have to be beautiful, just scrunch it fast. Once I can see the internal seam, I find the corner of the pillow that has a tag. Why do I want this tag inside of the pillow and not sticking out?
So it don't touch the patient.
It can scratch their neck. Very, very good. So seam to seam. Hold the pillow in the center. Pull the case down. Don't shake. Very slowly. Make an envelope. Excess material, all you're gonna do is just fold it in, and now you have a pillow perfect for your patient who's a princess. Y'all better start eating. Lord. All right, so can I get, let's see over here, we're gonna put you back in your, so if I can get you in the bed under the sheet over here, Asia, and then if I can, were you with Miss Marlene, right? I'll put you back with Miss Marlene, it doesn't matter who's first. Marlene, I guess the queen has spoke. If you'll get under the sheet for me, Miss Asia, under the sheet. And then my CNAs who are up working, don't forget that whenever you get to the side of the bed, if their shoes are sticking out, that is a safety hazard for you as the caregiver. So what would you do once you're on that side of the bed? You don't
Remove the
Slide them
shoes.
under the
slide
bed.
them, and you don't have to do it right now, but then when you're done with the care, what do you do with their shoes?
Put them back.
Put them
Put them back out, that way they can't say they couldn't walk with their shoes because they couldn't find their shoes. Alright, so CNAs, I have already set up your stations. We're gonna have a shared laundry basket. I'm gonna ask that you get on the same side that you were on for a change of position. So get on the right side of your residence. That's the left. Come over here, Miss Marlene. Safe positioning. Remember at the test site, do not assume that you're working in a hospital, nursing home, or home care. Right now, these beds do not have rails on them. Even if it did have rails, if you turn the person and their face is in the rail, you do not turn them safely. So how do you provide safe turning? What are you asking to do?
Make sure they
Scoot towards me a little.
Go talk to your resident. Good. And if you can, your call bell, we've done the HCC, we've done our intro, our hands are clean. And for this skill during the test, when you reach for the gloves, your nurse is going to say gloves are not required. Of course, in the real world, we're gonna have on gloves for this skill. Alright, so if it doesn't reach over there, I can put it over here. Will it reach over there?
Yes.
Okay. Alright, and so now you can fan fold your sheet, but have your person turn so they're on their side.
Can you turn towards that way for me?
And you want to expose the backside. You need to see what you're working, what area you're working with. It's not overexposure. And from the top to the bottom, you wanted to move somewhere, you gotta talk to her.
Table. Yes, yes.
Alright, and so now bring this up, Miss Marlene. Bring it up and over, all the way top and bottom. Alright, and so now that bottom sheet, you wanna roll it in. Cause in the real world, there'll be pads in this, it could be some, cause you would've done this after a bath. So you wanna contain whatever's in it. Roll it, don't push it, just roll it. And you wanna make sure you don't, there we go. Good, roll, roll, roll. Doesn't have to be perfect, just roll and then you can push once it's close to the patient. Make sure you don't tear their skin. Roll and push, lift up their leg if you need to. Good, good, good. Make sure that none of the dirty sheet is sticking out beneath the pillow. And we left the pillow on the bed for comfort. It doesn't feel good to have a patient laying flat. Miss Marlene, I hate to say this term, but if you can see it, meaning your sheet, whatever's on that other, it's gonna get on your new sheet, so push it through. If there was some obvious contamination, fecal matter, something on the mattress, how would you remove it?
Soap and water.
Soap and water. We don't use sprays in the facility. And then you can put a clean, dry towel through, and that is going to prevent your new sheet from getting contaminated. Do not, fan this. You're gonna unfold it on the bed. There's your fitted bottom sheet. Here's your fitted bottom sheet. Please check on your patients, see if they're okay. Alright, unfold, unfold, unfold. Can't do it in the air. On the bed. On the bed. Alright, so Marlene, I'm gonna help you over here. I'll hold your bottom at the test site. Your nurse will not help you, just go to the top. And then I'll come over there and help you also. And so then I want you to pause. Once you have your corner secured, I want you to roll this towards you, because we need to get rid of some of these wrinkles. What do the wrinkles cause?
Skin sore.
Yep, pressure sores, get rid of some of these wrinkles. And then Marlene, just one more thing, if you can lift up the center of your mattress and allocate some of this, sheet. There we go. Very good, now push it towards, I don't see any wrinkles, so push it towards, you may have to let your resident know you're gonna touch them and lift their bottom a little bit. You wanna push it towards to get it under them.
Just gonna touch a little bit.
Okay.
Good job, ladies, good job. Go under, Marlene. Marlene don't like telling you when she's touching on you. That old school Marlene.
I told her.
I apologize.
I told her.
All right, and so, ladies, great job. If you would now ask your residents to lay flat.
Can you lay back flat
Can
for
you
me?
lay back on your back?
Very good, Marlene, for moving that sheet. Very good. And don't bring the sheet back out, because the ultimate goal is for that top sheet to come off. So you'll keep it fan folded on top of your resident.
Okay.
Now, if you don't feel comfortable with where your resident is at, and they're near the edge of that bed, what do you have them do before you move?
Can you scoot
Back to
over
the
that way
center.
Just a little
Yeah.
bit.
So you know she likes to turn, so you want her to scoot, may have to do it for her.
Come back on your own back.
Good, and now recover her, and at the test site, if that were to happen, you just say correction if you overexpose. Now carefully walk around to the other side of the bed, and now fan fold the other half of that sheet on top of the resident. The sheet is providing privacy and warmth at this point, privacy and warmth. If it was obviously contaminated, we would have removed it already, and fan fold it now up. Awesome. You cannot pull anything from beneath your resident. So now you gotta get them to shift again, to come towards you again, and now turn away so you can see their bottom. So come to me, come towards me. Talk to your resident, I'm sorry.
Oh,
That's what you're telling your resident.
okay.
So,
Thank
cause you
you.
need to see her,
Thank you.
back. So it's gonna be come towards me.
Can you come towards me? Like scoot towards this way?
Good job. Okay, and now we're gonna turn
Now we're
away.
gonna turn that way.
And if you feel that she's too close for the edge, you can have her scoot back again. Okay. And now everybody pause. Bring your butts towards the foot of the bed. Butts towards the foot of the bed. Which direction do you take off dirty linen?
Away from
Away
you.
from you. Roll it in and keep your arms extended as you're taking it off. Roll it in, keep your arms extended as you take it off. 2 hands, let's go, let's go, let's go. Don't bring it up in the air. Remember, you have pads and all types of other stuff in there. Please move her hair so it doesn't get caught. Conveniently, your laundry basket just happens to be right next to you. Can you put dirty laundry on the floor?
No.
No. Now you can pull tight and bring out that new sheet. Pull it tight. Good job, you all. Your legs haven't been touching the bed. I'm so proud of you. Pull tight and tuck. Pull tight and tuck. Great job. Check on your residents
Are you
again.
okay?
Good. And so then, yeah, pull it tight and then tuck it beneath the mattress. She can lay back. You're good.
Thank you.
Don't uncover her. She can't be exposed. There we go. Now you do have enough room for your top sheet. Here you go. Let me know if you need any help. Okay, good, and that's fine. And once she lays flat, you can start with your top sheet. Don't stand it in the air, Miss Marlene. Just find out what part goes over the footrest and allocate it.
So I can go ahead and take this off.
You can take it up to her knees, because
Okay.
it's still providing privacy and warmth at this point. Okay, and here you go, don't let it touch you. And what you wanna do is find an end and bring that end over the footrest. So bring it all the way over, and then that way you'll have room to tuck. And then you can go towards the top, and you can make your tent. Hand in the center, so one hand on the clean, as the other hand removes the dirty. Good. I'm gonna allocate over the footrest. And then one hand in the center. And then this is forming a tent, so no one can see what's beneath her sheet.
Okay.
Good, keep on rolling, keep on rolling. And then once you get it up past her waistline, you can take off the dirty and pause, because that is dirty. Take it away, laundry basket, then you can go back and finish making your bedding. Patients, are you all doing okay?
Yes.
All right, you have to have enough material to tuck in at the bottom. So lift the mat, you may have to pull it down some, Marlene, make sure you have enough. There we go. Literally pick up the mattress and tuck the bottom. Pick up the mattress and tuck, very good. And now make your mitered corners, up, tuck, down. These are some great beds, ladies. You got it, you got it.
I'm gonna change it.
Are you sure you okay, baby? What's wrong, dear? You're cramping? Go ahead and get out the bed, okay? You wanna sit up? All she has to do is the pillowcase. That's all she has to do. You don't need to be in the bed for the pillowcase, okay? You want me to help walk you to the room? You okay? You've been doing such a good job, so I'm so proud of you. You should be okay? All right. Pretend her face is still there, so don't take the pillowcase off in front of her face. You would actually move towards the foot of the bed.
Okay.
I'm so proud of you, Marlene. I see you, Marlene. I see you. I see you. You're doing it. You're not shaking the pillowcase. No old school CNA, PCT stuff. Very good.
Had to get with the program.
So back in the day, they just did whatever they wanted. It wasn't like,
Linen on the floor.
yeah, linen on the floor. Yeah. Cool. Hey. You all used to come in with your own carriers of supplies, like baby powder and everything else, lotion.
Shampoo.
Yeah, the older CNAs, they,
Had a please?
if the hospital didn't provide it, they came to work with it.
You
There was a
comfortable?
lady, about, Miss Marlene's age, and she always brought soap to her residence.
Mm-hmm.
So did you call
All right, Miss Martin, I'm so proud of you,
Anything else I
ladies.
can get bigger?
Damn, great job. All right, and so she's just gonna make her envelope, and then she's done over here.
I gotta put it back on the bed, right?
Yeah, you can.
Okay.
Yep, because it's clean, and if not, you can put it on the bedside table. And all you're gonna do is tuck it, so it doesn't matter which side, just tuck both on one side. Bring it down, tuck it in. You can lay it flat if it's easier. Yeah. And you can do this on the bedside table. Look. And can I tell you, that's also not a requirement, so you.
Oh.
Yeah, you just.
Just neat.
Applause, everybody. Your patient's still in the bed, cover's still there. Great job. Asia, are you going to be okay with doing this skill? And if not, you can just watch.
I can go.
Okay, all right. So, ladies, you all can trade places. I'll pull out some new linens.
Oh, get in the bed.
Yep, get in the bed. Your bed looks so awesome. Now you can take you a quick nap before lunch. Okay, you're too young to be saying ooh-wee like that. It's way too young. My stomach's growling to everybody, so it's almost time for lunch. It's like y'all done worked half of an 8-hour shift already. All right, so ladies, I have your new linens out. Remember at the test site, this will be a sandwich. You will come into your intro, wash your hands, address the curtain, all the other stuff, remove the call bell. Then you get your supplies. More than likely, the patient's gonna be sitting upright for this skill. You cannot turn someone or change their linens if they're upright. So you have to put the position down. I don't have any chocolate. What is that flat position called if you take the U out? So sorry, it would have the U in it, so.
Oh, supine?
Supine, I apologize. If I had chocolate, you have it, girl. All right, so start off on the right sides of your patients, just for our classroom. Good job. Safe positioning, safe turning. I need to hear your voices.
Hi, I'm Asia. I'm gonna be a CNA for today.
That's okay.
Is it okay if I change your bed?
And so start with safe positioning. You don't start with linen. She's not positioned properly. And then after that, turn to the side and then fan fold your sheet. So Asia, stop. Get her to the side. Ask her to scoot towards you.
Oh, can you scoot towards me?
And then ask her to turn away.
And can you turn on your side?
Asia, your legs touching the bed. They're gonna mark you off for that. Okay? And I'm gonna pause you because it's not time yet. You want to expose her backside. Everybody expose their backsides. You're in the room with the curtain pulled. You have a right to see.
Okay.
You want to see what is beneath your patient because fan fold, fan fold, fan fold. All right, and so now, very good. Fold or roll that bottom sheet in towards her. You can't get your new sheet because you still have an old dirty sheet on the bed. And roll, roll, roll. Remember in the real world, it's not push because it could be pads and poop in there. You want to roll. In the real world, you'd be doing this because the patient really did something in the bed. Good job, good job. And because your patient has a little more assets, you want to tell her that you're going to be touching her and get that under her, okay?
Okay, that's
We're going to be
okay.
touching you and now push it under.
On your bottom?
Okay.
So everybody look at my hands, especially with a woman. When you go under a woman and your hands are up against her butt, what does it feel like?
Uncomfortable.
It feels like you're groping her. Hands down. Push that sheet under with your hand, your palms down. Okay, push it under. Lean her forward if you need to. Push it under. You can't be too gentle. Most of your patients are going to be larger than you. Push and get it under. Get it under. Get it under. Get it under. And then you can bring her back some. Great job, ladies.
So they can touch the.
So she's only touching a little bit of the mattress. So technically she's still touching this. So, and you won't lay her back yet because what's about to happen now? The other fitted sheet, okay. Alright, what had happened? She moved you all the way back?
She told me to come back.
You okay? Miss
She
Marlene?
can't come back, she needs to be in the center. Put her back where she was.
Can you come back to me?
Yes.
I'll follow you.
Alright. Alright, unfold it on the bed. Alright, you know, I know y'all are used to the sheets. Ma'am, that sheet's touching you. That sheet's always touching you. And in a minute, I'm gonna stop saying sheet and accidentally say something else. You can't let stuff touch you. Alright, then, before you go any further, lift the mattress, tuck in the center. Alright, I got this part, before you go any further, lift the mattress, tuck the center, lift the mattress, tuck the center. Listen to me, Asia, lift the mattress, tuck the center. You wanna tuck that material under the center of the mattress. Good, fix that top part, cause for some reason it's uneven. Is it on the frame? Okay, roll this tight. You can't just push it, you need to roll it to get the wrinkles out. Roll it, get the wrinkles out. See how I have no wrinkles, but you do? And now push it towards your resident. Hands down, palms down, go under. Palms down, go under. That's palms up, palm down, go under. Get under your resident. Push, 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 push. You all have 15 patients. Good job. Your patient can lay flat. Good job. Your patient can lay flat too. And right now, just lay flat. That is it. Pause. Take a deep breath in. Your patients are too close to the edge of the bed. What's next? Say,
Can you move to the center a little bit?
very good.
Right.
Alright, when you walk around, cause you can't pull anything from beneath the patient, walk around, fan fold that top sheet. Because you can't pull things from beneath them, you need to see what's actually beneath them, you wanna see what's going on. Fan fold that top sheet, so all you're doing is, you're not trying to put it back on her, cause the goal is to take it off of her. I'm not gonna do it for you, you're gonna pick it up, put it on top of her. Pick this one up, put it on top of her. Don't touch this one. Pick that up, the top sheet, put it on top of her. Good job. Keep it there. You overexposed right there. There we go. Alright, and so now you still can't get to the bottom sheet because your patient's on top of it. How do you get access to the bottom sheet?
Ask them to move to the center.
Safety. As a CNA, what's gonna make you fall right now?
Shoes.
The resident shoes. Move those shoes out the way, okay? Alright, ask your residents to come towards you.
Can you come towards me?
Like, on your back. Oh. And then turn away.
And then turn to your side.
Okay. Alright, if the sheet moves, you can move the sheet a little bit so they're not too exposed. Alright, great job. And now your backs or your butts come towards the footrest. Backs and butts towards the footrest, because when you're taking away your dirty sheet, you don't pull it up in the air, Asia. You roll it up and away. Look at Regina. Roll it up towards the top. You're containing everything. 2 hands, roll, 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 roll. Don't overthink it. 2 hands. This is dirty. You're taking this off. This is clean. Pause. Do not let the clean touch the dirty. Take the dirty off. Roll it up. Just don't pull it. Roll it and contain it. Roll it up and away. Oh, so you're gonna have to use some muscles over here, girlfriend. You got to pull this sheet. Pull. Let's pull. Oh, yes. There we go. Pull and tuck, pull and tuck, pull and tuck. That sheet touched you twice, Miss Asia. What do you need to say? Correction, okay. Get that bottom sheet from beneath her. Let her know you're gonna be touching her.
I'm gonna be pulling the sheet from under you, okay?
Great job. Okay. Let's pull, let's pull, let's pull. Gotta pull sometimes, okay? Let's go. Good job. Work your way to the top. Pull some more. And you may want to lift her skin some, because we're not supposed to be shearing or tearing like that, but sometimes we just got to do it when they're larger. Not that you're larger, it's just that she didn't push it through enough, okay? Alright, so now this is what I'm going to do. I'm going to pull and tuck, and you keep doing the same thing from where you are. Pull and tuck, get up on that edge, and bring it up to her knees. And then that way you have a working area. If you can get that wrinkle out, try to do so, but that wrinkle won't fail you. The only wrinkles that fail you are the wrinkles that are beneath your resident. Check on your resident, see if they're okay.
Are you okay?
Yeah.
Alright, your resident can lay on her back. Good job, Asia. I think you're getting the rail instead of the mattress, so lift the mattress up so you can separate the two. You're fine to continue with your top sheet.
And you can move back to the center.
Alright, get that sheet from behind her, Asia. She can't have that sheet wrapped around her. Don't take it off, just get it from back. There we go. And now cover up her front area. Don't spread it out, because you're gonna take it off, but just keep her covered. So it's gonna look like this. Perfect. And now, here's your new sheet. Find the edge. You wanna find the very end of the sheet. I'm proud of you, ladies. Great job. She in the service. I know she can make a bed. I'm gonna leave her alone over there. All right, let's see over here. All right, so it's actually gonna be the other way. I think this is the open end. The open end goes towards the foot of the bed. So bring that end towards this way. Bring the end that you have there. This is the open end. Bring it here. The whole two pieces. Bring the whole thing. Bring it around, bring it around, bring it around. Don't tuck it yet. Bring it over the edge of the bed. Both pieces, bring it over the edge of the bed. Awesome. Now work your way to the side. Pause. We're separating, stay down here where I am. We're separating the two layers. You need the first layer. The one that's in your hand, put it in your right hand. And see where my hand is right here? It's gonna be in the center. So right hand in the center where my hand is. Drop the material out of your hand. Bring your right hand right here. This hand is going to remove, so this is forming a tent. Let's talk about this. I shouldn't see any of this. The way I'm not going to see it is you're going to hold this up, and as you gather this material with your left hand, you bring up this sheet. Okay, so let's try that again. I don't want to see this. I'm a visitor in her room. Don't let that sheet touch you. Don't let the sheet touch you. Stop. Take away the dirty. Take away the dirty. Take it to the laundry basket. Take it to the laundry basket.
Can I tuck this?
You certainly can. Oh no, just the layer beneath
Oh,
it.
just this one.
Just the layer beneath it.
What is this?
I'm sorry, Miss Marlene. Bear with me. It's okay.
Good. And now you just have to tuck the bottom of your top sheet under the mattress. That's the side. We don't tuck the sides. Untuck whatever you just did, Asia. Asia, step down to the very bottom of your bed. Very bottom. Tuck. See how our bed is at the bottom? Tuck this bottom. Tuck this material beneath your mattress. Lift up the mattress and tuck it. Good. Mitered corners are optional, but the sheet does look tight on your resident's toes, so what do you want your resident to do?
Loosen.
Good job. Very good. If you don't feel like doing the mitered corner, you don't have to, because if you tuck the sides, Asia, I keep telling you, if you tuck the sides, if it's not a mitered corner, they're gonna fail you. You make a restraint. Okay? What's the last thing you have to change over there, Asia?
Pillow.
Awesome, you got it. Great job, everybody. Miss Marlene, I charge you extra if you fall asleep. I keep telling you that. So
Yeah,
you get the
thank you.
dirty pillowcase first, and then you can put on the clean pillowcase. So let's,
The pillow.
good job, you got it. I see you. I see
You
you.
don't have to do the corners.
It's not a requirement for the test, no, but I wanna make sure that you know how to do them. You can't put the dirty pillowcase on top of the bedside table. You can put the pillow on top of the bedside table. So remove the case, and then you can work with your pillow. Just pull it off. Don't overthink it. You're not rolling the dirty. You're just pulling off the dirty.
Okay, Miss Marlene, put your head up for me.
Just pull, pull, pull. Don't let the pillow touch you. You can put the pillow on top of the table, and then you can prepare your new one. All that hard work you did to make that top sheet even, and guess what?
It's still uneven.
It's still uneven.
I can't see straight.
Great job over here. All right, and then we're almost done over here. Step back, Asia. The top sheets, that pillowcase is touching your uniform. So arms extended, nothing should be touching your uniform. I'm proud of you, ladies. And look at you all, great timing. You all get a quick break, and then we will start back up again and do our last skills. Alright, so how do you all feel about your new roles as CNAs? It's gonna be fun. It's gonna be a lot of work. Are you trying to do 12-hour shifts?
Probably because I'm used to it.
Okay, okay. We here over here shaking this pillow. I ain't gonna correct her no more. She tired. I ain't gonna, that pillow just being shook.
Don't shake the pillow.
Don't shake the pillow. Your teammate's helping you out. Don't shake the pillow.
Use your hand and just pull it over.
Then, the next time, make sure the
tag.
tag is inside of it.
When
It
she's
could
home,
hurt the resident.
when she's home, she'll process it more. She'll watch the video again and she got it. All right, and you don't have to make the envelope. You can just fold it and put it under your resident's head. Proud of you ladies. Applause. You all have covered a lot of skills today, so why are you looking at me
I
like that?
mean, I felt like it's a lot.
It is
Yes,
a lot.
it is a lot. And I mean, it's worth it.
Mm-hmm.
And for me, as an old CNA, I learned so much.
For real, I'm so happy to hear that.
It's like-
Aw. You're getting
It's a new
refreshed.
thing, yeah.
Yeah, so, I like to think that it doesn't matter whose class I'm in, I can always learn something.
Yes.
So ladies, give me a takeaway from the first half of today. You're almost done with the CNA class, you done learned a lot of skills over 2 days. Give me a takeaway. If someone asks, what did you learn today or what did you do today? What would you say to them?
I learned a lot. I
The
learned-
proper, I know it's not hair and nails, it's
Mhm.
just hand care, manicure.
Yes, for the test, yeah, because you
I
gotta
like
be
the hair.
universal.
Mhm.
How do they comb someone's hair with locks?
Yeah.
You don't, you style it. And so, I'm a real advocate because I get a lot of students in here from different backgrounds, is I let people who may not be familiar with our hair types, I let them touch our hair. Because otherwise, how are they gonna know how to take care of an older person's hair who's coarse if we never let them touch our hair? As if it's like this forbidden secret, you can't touch my hair. So,
Like you said, for the test, the emerald board and the
yes,
cuticle thing, we didn't have that before. So all that's new to me.
I'm happy that you're learning something.
Yeah, because if I see that, I just see it, I wouldn't know what to do.
Because that's not something we would do in the hospital.
We never practice those things.
Remember, your test is not geared toward one environment, so it's taking care of all environments, anywhere where there will be an adult resident. My last 2 ladies, give me a takeaway before you wash your hands and.
Not to flip toenails or use the file
On the toes,
toenails.
yeah.
I can't do that for both.
Yeah, very good. What about you? Give us a takeaway from today.
Does that have to be, on the skill?
Yes. Oh, no, whatever you're gonna, if someone said, what did you learn today, what would you tell them?
I learned about, the blood pressure readings yesterday.
Very good, very
That was
good,
new.
very good. I'm proud of y'all. Read, wash your hands. I only give you 15 minutes without me, so we'll resume at like 12:25. Okay? Great job, team. I'll make up the beds. Great job.
Miss Shannon,
Yes, ma'am. Let me cut this off.
Is it okay if I use one of these things?